The Kilbundura Base Hospital is a Victorian government-funded public hospital which provides health services in and around the Kilbundura district. We are a 150-bed-based maternity, medical and surgical hospital which aims to ensure that all patients that are either admitted or visitors within our hospital receive the highest possible standard of care, building a healthier community. Due to these beliefs, we have identified issues within the hospital that need to be fixed. We aim to implement a plan to correct these issues and, together with senior management, make our hospital not only one of the best rural hospitals within the community, but also on a broader scale. It has been noted for some time now that the diabetes and endocrinology unit has needed a major upgrade to their dispensing and provision of prescriptions. We have found that nearly 3 in every 5 patients have at some point been faced with problems in relation to the prescribing of their medications within this unit, and we find that these numbers are far too high. Due to these errors, we have decided to introduce an e-prescription system to the department. Due to limited funding, we have decided to limit the initial trial to the endocrinology and diabetes department with the goal of expanding if successful. Within our system at Kilbundura, the pharmacy, we will fill prescriptions for the hospital's patients and distribute these to the nurse station responsible for each patient. The prescription will be keyed into the system by the doctor, who needs to be authenticated within the e-prescription system. This authentication is done by swiping the staff ID card and the input of a password which allows access to the system, enabling the doctor to process prescriptions. These prescriptions take into account the patient's information such as their blood sugar level and current weight, and after filling out the script and taking it into account these factors, the prescription is then sent to the pharmacy where the pharmacist reviews the patient's script and checks the patient's drug file to determine appropriateness. An example of this is whether the patient has any allergies, whether there are any contraindications, or whether there are any errors within the prescription. Errors of dispensing may include the confusion of different types of insulin, where short-acting is prescribed but long-acting is dispensed. The system will be able to remind the pharmacist to double-check which insulin they are dispensing, ensuring that errors are minimized. After receiving the prescription, the pharmacist then fills the order and checks to see whether the dosage is safe, whether there are no known allergies to the drug, and drug does not interact negatively with any medications that the patient is currently being administered. If the pharmacist decides not to fill order, doctor is contacted and advised of any issues. The doctor may then decide to have order filled anyway, or the doctor may write another script and resubmit it to the pharmacist. Once the script is filled, label is generated with patient info such as the UR number, name, room number, doctor's name, date of birth. Script information such as the drug name, amount dispensed and dosage, and medical information which contains instructions. After this, the label is put on the drug container. The patient ID and information with the drug dosage script are entered by pharmacists into patient drug file. UR, drug name, amount dispensed, and cost of drug are entered by pharmacists into online cost center system. The drug container and corresponding order are then sent to the appropriate nursing station to be administered to the patient.
So that this system functions effectively, there are a number of system requirements that will need to be met. These include certain inputs, processes, outputs, and performance and control measures. Inputs for our system include blood sugar levels, chipped ID cards as a means of authentication, prescriber number, name, the drug name and dosage, which in terms of our system will be insulin and the level required for the patient, and also the PMI, acting as an input to the diabetes insulin e-prescription system, allowing an exchange of information such as current weight, addictions, allergies, and the UR number. Processes refer to what is to happen as a function of our e-prescription system. These include error checks. The system will pick up on inputs and determine whether they are incorrect or whether there may be any contraindications, for example, any wrong dosages. The system will then provide the user with a warning, using information from MIMS for drug interactions. Authentication is also a process. Further to error checking, the system will only allow continuation once the appropriate authentication input is provided, i.e. ID cards, PIN number and password. For example, only a doctor is able to prescribe. Nurse-level authentication will not be able to complete such duties. Electronic prescribing is also a process of our system. If all information is accepted, the process of e-prescription will be carried out successfully. The output for our proposed system will be an insulin e-prescription containing the required amounts of insulin for the relevant patient. In terms of performance, our system will be accessible 7 days a week, 24 hours a day, every day of the year. There will also be an off-site hard drive that will store and back up the information recorded using a Kilbundura Hospital e-prescription system. Controls included for this system are security. Authentication is required in all stages from endocrinologists, pharmacists and nurses, each of which has a certain level of authentication allowing access and ability to complete different items. Further to this, ID cards, a PIN number and a password are required for clinicians to be able to access the e-prescription system. Audit trails are an additional security measure. The ID cards used to access the e-prescription system records a footprint on the patient's e-prescription, enabling audit trails so that if any issues are encountered during the e-prescription process, visibility of where any errors occurred will be possible.